Have you ever had this happen? You're having a good session with your therapist, and suddenly your family asks to join and sit in. Is this helpful or disruptive? In therapy, sometimes family members or partners are the ones who push the client to start therapy and then ask to sit in on the sessions. Other times, the client may invite their family or partner to join and observe. This can sometimes make therapists feel anxious because having others in the room can disrupt the therapeutic relationship. But let's not forget, therapy time belongs to the client. The client is paying for the session, so if the therapist feels anxious, that's not the client's responsibility. If the client wants their family or partner to sit in, the therapist doesn't really have the right to refuse. So, what should therapists do if they feel anxious? One good option is to talk to their own analyst or supervisor. Often, this anxiety comes from their personal beliefs about ethics and maintaining the privacy of the therapeutic relationship. A therapist might feel they need to stay professional and unaffected by external factors, which can unintentionally make the session more about themselves than the client. Sometimes clients want their family or partner in the session so they can express emotion they usually can't outside of therapy. In these cases, having someone else in the room can actually be therapeutic. Of course, if the therapist feels that having family or a partner in the room would negatively impact the therapy, they should discuss it with the client directly. Do you want your partner or family to sit in on your session? This helps figure out whether it's truly the client's decision or if they're being pressured. The 50 minutes of therapy are yours. You decide. If you want them in the room, invite them in. If not, let them wait outside. If family or partners don't understand this, therapists might need to explain. We're doing this to make the most of the time and to help the client in the best way possible. It's worth noting that many family members or partners who ask to sit in are doing it out of a desire to protect the client. When everyone's goals align, these situations tend to be easier to manage. When family or partners join a session, it can sometimes feel like supervision or a shift in power dynamics. In therapy, the client has the floor. They get to speak freely, while parents or partners are usually there to listen, not to talk. That said, third parties in the therapy room might interrupt from time to time. Therapists should note these moments and later, while reinforcing the boundaries of the session, use them as opportunities to explore. They might ask the client, "How did it feel when you were interrupted while talking about this?" Or they might ask the family or partner, "What was going through your mind when you felt the urge to interrupt?" By bringing the family dynamics into the therapy space and helping everyone feel those relational dynamics more deeply, therapists create opportunities for real change to start happening.